Patients who do not stay close by will have less need to go many times to the hospital, less cost, less inconvenience, less distancing from their family. So that is a big benefit. When it comes to breast cancer, the treatment involves a whole list of modalities that includes surgery, with or without chemotherapy. Some patients may or may not need radiotherapy. Some may need targeted therapy. And also there may be some patients who actually either are not suitable for surgery or refuse surgery. So it's a whole gamut of things that you can provide and you can give for breast cancer treatment. So towards the end of the 90s, 98, 99, a group of doctors and scientists in London looked at why can't we look at better ways to provide radiotherapy instead of causing difficulty to patients. So we always want to treat patients, but we need to improve on how we give it to the patient. The purpose of radiotherapy is to protect the rest of the breast tissue in that particular breast that has the cancer. So why not at surgery, once we remove the cancer, in that cavity, we can provide radiotherapy direct to the tissue that we want to protect. Okay, and then once that radiotherapy is done, one single dose, one shot, then you close up that cavity where the cancer has been removed, and that's it. So the type of patient that can be treated this way is patients who come from far away. They come in, have the surgery done for the early breast cancer, give radiotherapy, and then they can be seen like several weeks later. So they don't have to come daily. It doesn't involve cost. It doesn't involve them leaving their families, especially mothers with children, for a long time. That study started in London. Later on, they looked at patients who have intraoperative radiotherapy, but they need that extra dose because the cancer has spread further on, that these are not the early breast cancer. We call it the additional dose. It means that the whole amount of radiotherapy can be reduced because you've given part of it during the surgery itself. So that also reduces the time for radiotherapy. Yeah. So that's for the more advanced breast cancers where you say we need the extra dose, but why not we give some during the surgery and then you cut down on the duration. So you can reduce between 5 to 8 visits. So that means something. This is done while the patient is under general anesthesia. So the patient doesn't know and does not realize, does not feel any pain. So basically it's done for early breast cancers, just one sitting. Alright? And then it is done immediately after the cancer is removed. So the timing is really good. Okay? Now, the conventional way where they give external beam radiotherapy, the cavity is closed. Okay? The wound needs to be healed properly, no infection, etc., no swelling for about a month or even 6 weeks, and then they go for radiotherapy. So during that time, that lag time, we always wonder, if there is a few cells hanging around at that cavity. That timing is crucial. Patients who do not stay close by will have less need to go many times to the hospital, less cost, less inconvenience, less distancing from their family. So that is a big benefit. And also in terms of health tourism, it is actually quite remarkable that you can, get somebody in, they stay for maximum of 1 week or so. Usually if those stay overseas, we prefer to wait until we can remove their wound stitches about a week after the surgery. So maybe they stay at the max 2 weeks have everything done, and go back to their hometown. And then the next time we see them is maybe about 6 months later or something like that, depending on the type. So that dose that you can give max at that time is a certain calculated dose. You can't give too high because then you have side effects. Okay, because radiotherapy is, in a more simple word, is like burning the tissues around it. So if the patient has recurrence, that breast cannot be radiated anymore, most likely not. So there are other ways to treat patients with recurrence, for example chemotherapy or further targeted therapy, depending on the subtype of breast cancer. Okay, because breast cancer has many subtypes.